chronic dry mouth affects more than 40% of people over the age of 65. And in most cases, the problem is not in the mouth. It is in the medications you take and what happens while you sleep, or in something your routine tests have not detected yet. Today, you will understand each one of these causes and what to do with this information by the end of the week. And there is one thing in particular I want to show you before we finish, something most doctors do not explain during appointments. But I will get there. My name is Dr. Thomas Ellsworth, and aging health is something I have studied and followed closely for years. If you're not subscribed to the channel yet, do that now. Saliva is not just water. That needs to be clear right from the start. It contains enzymes, antimicrobial proteins, and compounds that protect your tooth enamel, aid digestion right in the mouth, and create a barrier against bacteria. When that production drops, the consequences come in a cascade. Cavities that appear out of nowhere, throat infections, difficulty swallowing, and in more serious cases in older adults, aspiration pneumonia, a severe lung infection caused by bacteria that should have been neutralized by saliva before reaching the airways. Have you ever woken up with the feeling that your tongue was stuck to the roof of your mouth? That your lips were dry even after a full night of sleep? If so, you know exactly what I am talking about. Now, the question that matters, what is causing this? There are 6 main causes, and each one has its own logic, its own specific sign, and a different response. The first is the one that surprises people the most: invisible chronic dehydration. After 60, the hypothalamus, the region of the brain responsible for detecting that you need water, begins to lose sensitivity. Studies published in the European Journal of Clinical Nutrition involving more than 800 older adults showed that 65% had chronic dehydration with no complaints of thirst. That means you can be losing nearly 4% of your body's water volume without feeling thirsty at all. The body is dry, the brain does not send the signal, and the mouth is the first place where that shows up. Judith was 68 years old and only drank water at meal times. She thought that was enough. When she started monitoring her intake with a marked water bottle, she realized she was not even reaching half of what she needed. Within 3 weeks of adjusting her hydration, the dry mouth she had every morning had almost completely disappeared. The marked bottle strategy is simple and it works. You take a 2-liter bottle, mark it with tape at intervals throughout the day, and visually track whether you are hitting your goal. No depending on thirst, no forgetting. 1 glass when you wake up, 1 before each meal, and 1 before bed is already a solid start. But hydration is just the first piece. What if the problem is happening while you sleep? The second cause is sleep apnea, and this is one of the most underestimated. When you stop breathing during the night, even for just a few seconds, your body reacts by opening your mouth to compensate. This happens repeatedly over the course of hours while you sleep without realizing it. The result is a completely dry mouth by morning. Studies show that among people with severe sleep apnea, the incidence of dry mouth is 10 times higher than in people with no breathing problems. 10 times. And the sign that almost always comes with it, early fatigue, that feeling that you slept but did not rest. If you snore, wake up with headaches, or feel a tiredness that never goes away, it is worth investigating. The test is called a polysomnography. It records what happens to your body during sleep and can reveal something you never imagined was happening. Donald was 71 years old. He snored every night. His wife had been complaining for years, but he never took it seriously. When he finally did the polysomnography, he found out he was stopping breathing more than 40 times per hour. After treatment, the dry mouth disappeared. So did the fatigue. The third cause involves your medications. And this is where things get more complex. The U.S. Department of Health has documented more than 400 medications that list dry mouth as a side effect. 400. Blood pressure medications, anxiety medications, antidepressants, antihistamines, bladder medications. Many of them are used together every day by people who have no idea that the combination may be drying out their salivary glands from the inside out. This has a technical name, polypharmacy, and in older adults taking 5 or more medications simultaneously, the chance of developing chronic dry mouth reaches 60%. That is not a coincidence. It is a cumulative effect. The practical guidance here is simple, but very few people actually do it. Gather all your medications, put them in a bag, and bring them to your doctor with one direct question. Could any of these be causing dry mouth? Sometimes the solution is switching to another drug in the same class that causes less dryness. Sometimes it is adjusting the timing. Your doctor can only help if they know what you are taking. The fourth cause is diabetes, and this is the one that frightens people most when it is discovered late. When blood sugar is chronically elevated, the kidneys work harder to try to eliminate the excess through urine. That leads to fluid loss, and the mouth dries out. The problem is that type 2 diabetes can go years without being diagnosed. The person feels tired, gets thirsty, wakes up with a dry mouth, but attributes everything to age. Meanwhile, the high blood sugar is silently damaging nerves, blood vessels, and organs. Consolidated data shows that diabetes affects more than 30% of the population over 65, and a significant portion of those people do not yet know they have it. Dry mouth may be the only visible sign at this early stage. Carol was 66 years old. She woke up thirsty every morning and felt a constant fatigue she could not explain. She was convinced it was stress. When she ran the tests, her fasting glucose was high, and her glycated hemoglobin confirmed undiagnosed diabetes. Treatment completely changed how she felt. If you have not done a fasting glucose and glycated hemoglobin test in the last 6 months, write that down. Those two tests together are the minimum to know where you stand. And the sooner you know, the better. But the causes do not stop there. The last two are the least known. And one of them affects almost exclusively women after menopause. The fifth cause is Sjogren syndrome, and this is the one most often missed in medical offices. Sjogren's is an autoimmune disease. The immune system, which should be protecting the body, begins attacking the very glands that produce saliva and tears. The result is a deep and persistent dryness in the mouth, in the eyes, in the throat. A dryness that does not improve with water. That does not go away with time. It predominantly affects women. And the period after menopause is when symptoms tend to appear with the greatest intensity. It is estimated that 9 out of 10 diagnosed cases occur in women. Even so, diagnosis takes an average of 6 years to happen. 6 years of symptoms being ignored or attributed to other causes. If you are a woman in your 60s experiencing persistent dry mouth and also have irritated eyes or a sensation of sand in your eyes, that deserves attention. Not as an alarm, but as information. A rheumatologist is the right specialist to investigate this. There are specific tests available, and an early diagnosis makes all the difference in managing the condition. The sixth cause is the one that closes this picture in a way few people expect. The kidneys. When the kidneys begin to lose efficiency, the body accumulates substances that should have been eliminated through urine. This disrupts the body's fluid balance and dries out the mucous membranes. Chronic dry mouth can be one of the first signs that kidney function is compromised. And here's the problem. Routine tests often do not catch this early enough. Creatinine alone, which is the most common test used to evaluate the kidneys, can appear normal even when kidney function has already declined significantly. The test that truly shows what is happening is called the eGFR. the estimated glomerular filtration rate. It calculates the kidney's actual filtering capacity by factoring in age, weight, and other variables. It is more accurate, and it is rarely ordered. If you have never had this test done, or if it has been a long time, bring that information to your next appointment. Ask for it by name, eGFR. Your doctor will know what you mean. Now, what to do with all of this in practice? The first thing is to observe. For 1 week, pay attention to the pattern of your dry mouth. Does it appear only in the morning, all day long? Does it get worse on days when you take a specific medication? Does it come with excessive thirst, fatigue, or dry eyes? Write it down. That record will be valuable at your next appointment. The second is to act on hydration right now, regardless of any other cause. 1 glass of water when you wake up, 1 before each meal, 1 before bed, without depending on thirst. Use phone alarms or the marked bottle strategy if needed. The third is to bring your medications to your doctor and ask directly whether any of them could be contributing to the dryness. And the fourth, the most important one, and the one almost nobody does at their appointment, is to ask for the right tests. Fasting glucose, glycated hemoglobin, creatinine, and the eGFR. Those 4 tests together can reveal what is happening before the problem goes deeper. Dry mouth seems like a small thing. It seems like discomfort, something to push through. But it is your body communicating something, and bodies that communicate deserve to be heard. Do you wake up with a dry mouth often? Leave that in the comments. And if you take 5 or more medications a day, tell me too. I want to know if this information made sense for your situation. If this was helpful, like the video, share it with someone who needs to hear this, and turn on the bell so you do not miss what is coming next. Subscribe to the channel if you have not done that yet.